Heart attack victims often wait hours before calling for medical help, a delay that can be fatal. But a revolutionary device which simply plugs into the phone line means doctors can now keep tabs on patients while they're at home.
In most cases, the first time a patient knows there is a problem with his or her heart is when they have chest pains. Usually an ambulance is then called, followed by a stay in hospital for tests. But now with this handheld device, a trace of their heart can be taken and electronically phoned through to a heart specialist for an immediate diagnosis.
The facts of the matter are that for people who ultimately prove to have heart attacks, the evidence is that the average time they take between the onset of symptoms and their decision to call for medical help is between 4 and 6 hours.
Traditionally, this is the type of equipment used by paramedics or doctors in order to acquire a patient's 12-lead ECG. The equipment itself is very complicated, it's heavy, it's expensive, and can only be used by trained medical practitioners. But now the patient himself has a simpler and easier way of taking an ECG at home.
With one of these devices, there is no delay. The heart patient is encouraged to phone through an ECG as soon as he feels unwell. Only then, if he has an abnormal ECG, are the paramedics called.
There are some changes on it that cause a little bit of concern for me this morning, and I think you'd be better seen in the A&E department of your local hospital. I can arrange an ambulance for you.
At this call centre in Greater Manchester, nurses trained in interpreting ECGs download the data from the device and then decide if the patient needs medical attention.
Occasionally I've overstretched myself and I feel uncomfortable, maybe either with a chest pain or chest tightening, and to be able to go and sit in a room, take a reading, send the reading down the telephone line, just fantastic.
Derek Tedder, Sky News, Greater Manchester.